us for many, many years and many generations to come as well. So for those of you that have not seen or met me before, my name's Alistair Finney. I've worked at Whips Cross now for close on 5 years. And I'm the redevelopment director leading that programme for a new Whips Cross. As Sue said earlier, what a shame that in a way we can't do face-to-face. It's certainly my preferred way of operating. It's better to see and hear directly the people that we're talking to and also listening to. However, we are getting used, certainly at this end, to meeting in this way. So I hope you value the session that we're doing for you and with you this afternoon. And again, as Sue said, this really is about as well as us presenting our ideas and our thoughts, it's getting your comments, your feedback, and answering your questions on the early designs to help us shape and develop those plans further as we develop them ahead of a planning application early in 2021. So do use that chat function to begin posing those questions that we will respond to later on in the session. On this slide, I just wanted to highlight where we're at. It's titled The Story So Far. I'm not going to do the full 4.5 years of my life working on this programme, but I just thought there were some headlines to call out that do set the context. First of all, as part of the business case process, which we're required to do in order to secure the funds from the government, we completed our strategic business case earlier this year, and following that we continue to talk to the Department of Health about how we move forward on the outline business case, which is the phase of the programme where we begin to really develop the detailed plans for the future of Whips Cross and the site. Significantly, the government's endorsement has also given us some funding for the programme itself, and therefore we're operating to a budget of £12 million this year in order to develop the plans in detail, working with external experts such as Ryder Architecture that we've been so fortunate to bring on board onto the programme. We have also what we call our health and care services strategy. This was developed by our doctors, nurses and other clinicians over 12 months ago, and it really set the kind of view of what kind of services Whips Cross should be providing in the future. I think significantly, this does not represent a major service change, and I know in most meetings I emphasise that we will continue to provide a fully functioning emergency department, maternity department, and a full range of elective surgery as well. So not a change in the service scope, but what our clinicians have done have signalled a change in the way we deliver our care. So an increasing emphasis on same day care. That's both in day case operations, but also same day emergency care, and other things that have begun to materialise as a perverse consequence of the hospital having to respond to COVID this year and the enormous challenges faced with that, where, for example, there's been an increasing shift towards virtual outpatient appointments rather than face-to-face appointments. And we continue to evaluate the impacts that is having on patients, but also on staff. At the moment, we have a team that we call our healthcare planners, and they are translating the service scope for the hospital into a clinical brief for the new hospital. Thirdly, we've begun the detailed work around the hospital design, and we'll hear a lot more about that this afternoon from Paul and David and Ryder architect colleagues. And I'll say a little bit more shortly about our plans for outline planning application in early 2021. There's a number of cynics that work with me, and I know people will only believe the redevelopment when they actually see something for real. So I'm very pleased to say that our Enabling Works business case has been approved by government, and we've secured the funding to begin this work in early 2021. And certainly by March, I expect to see signs of the beginning of the demolition of the disused nurses' accommodation in the western corner of the site. I think this will be a symbolic moment for this particular programme of work. Those buildings have been up for many decades, they've been disused for many decades, and that part of the site where we will build the new hospital obviously needs to be prepared for the construction programme. So I think a symbolic moment at the end of the winter when we start seeing that demolition work. I also thought it was important to flag up our work on community engagement. We're very proud that we've begun to really enhance the way we communicate, engage and involve our local people and our local communities. We've established a series of focus groups, working groups, and we undertook a series of public meetings in October and November, again virtually and borough-based. And we've also established a new community forum to enhance local community organisations and our local communities' participation and involvement in the programme. Next slide, please. Thank you. So this is an aerial view. For those of you less familiar with the Whipps Cross site, this is an aerial view of the site. The red line shows the overall current boundary of the hospital, and what that also demonstrates is the significant spread of the existing hospital across the whole of the near 18-hectare site. In effect, that's a victim of haphazard planning over many decades and is not conducive to high quality patient care or indeed staff experience as well, given the length of the journeys sometimes that patients and our staff have to take. All our modelling is now showing that we can consolidate the new hospital onto a smaller footprint, and we've shaded that as blue across the site. And we'll see a little bit more about how that then is beginning to materialise into emerging design concepts for the new hospital. All of this will then be set out in 2 planning applications, which we intend submitting to Waltham Forest in early 2021. The first is what we call a hybrid application, which will include some details around the car park design, recognising the importance that we have a new multi-storey car park in place by the time we commence construction of the hospital in around 2 years' time. But it also then will include an outline planning application for the hospital itself. The second planning application will be for the development of the wider Whipps Cross site, which will begin once the new hospital is completed. So that will set out our ambitions for new residential accommodation and new community infrastructure for the wider site. Next slide, please. So this, in effect, acts as a segue into the second half of the presentation. We've been working with Ryder, our architect colleagues, in order to develop emerging designs for the new hospital, and we're now ready to share those emerging proposals for your comment and your feedback. What will continue to happen over the winter weeks is we'll continue to develop those designs in more and more detail, but taking on board the things that we hear from you and responding to the questions that you and staff and other groups raise during this period of engagement and consultation. And all of that then will be brought together into the hybrid and the outline planning applications, which we will submit to Waltham Forest as the statutory planning authority early next year. So I'm now going to hand over to Paul and David, our architects from the design team, to talk you through our early designs. Thank you.
Thanks, Alistair. So, good afternoon, everybody. My name is Paul Bell. I'm a partner at Ryder Architecture, and I'm leading the design team for the new Whipps Cross. So I'm very happy to be doing that. As Alistair said, we're at very early stages with the design. I want to talk through some of the principles behind what we're doing and some of the emerging design. And it's great to have this opportunity of engaging with you so that we can take on board the comments and thoughts that you might raise and feed those into the developing design, as I was saying, over the next few weeks and months as we progress through towards a planning application. So I guess this slide really is about some of the key principles that are behind the vision for a brighter future for Whipps Cross. And if we just go through those, the new hospital, it will need to be flexible and adaptable, safe and accessible, and those are absolutes. We know from our experience of designing several new hospitals over many years that the one constant in healthcare design is change. clinical and medical technology develops at a pace, models of care develop in response to that technology, and we get some different situations that face us, such as the one that we've been dealing with over the course of this year with COVID, obviously. So it's important that the new hospital is designed in a way that it is flexible and adaptable to respond to both short-term and longer-term change. And that's all part of a broader sort of approach in terms of sustainability as well. When we're designing the project, one of the key drivers is working towards net zero carbon, and that it has behind it the sustainability drivers. And when we're talking about sustainability, we are talking about that very much in broad terms. So it's about economic, social and environmental well-being, as well as promoting sustainable and active travel for the site. And we know transport is a key issue to a hospital site, and Whips Cross is no different. It's about providing stimulating green spaces for the community, and that is both the existing community of Whips Cross and the new community that the new homes will provide a place for. And it's about celebrating the retained heritage assets that Whips Cross has to offer, and we'll talk a little bit more about that as we go through the next stages of the presentation. I'll just move on. I'm going to introduce David, who is one of my colleagues at Ryder. David will introduce more about the site. I'll then talk about the hospital in a little bit more detail, and then David will talk to us about some of the plans and aspirations for the broader site. So over to you, David.
Thanks, Paul. Good afternoon, all. Good to meet you virtually. Yeah, so I think, as Paul said, we've been developing the master plan over a number of months now, and at the heart of that is the new hospital, as has been mentioned, incredibly important community asset, and something which acts as a real kind of linchpin for the further redevelopment potential of the site. So on this slide, we're just really highlighting some of the key elements of the approach to the redevelopment, developing a number of new homes, looking for a minimum of 1,500 new homes across the site, other ancillary support spaces and infrastructure for the hospital, including a new energy centre, and a multi-storey car park to serve the new hospital, and other uses which can add a real benefit to the site, not only for hospital patients, staff and visitors, but also the new community, and as importantly, the wider community as well. We're really passionate that this development stitches into its surrounding context, which is critical. Next slide. So just a little bit about the context. Our site sits within the centre of this slide here. You can see it really benefits from its connection to the Lowley Valley and Epping Forest to the east of the Whips Cross site. You can see there to the north we have Wood Street and a number of other local centres, including the larger centre of Walthamstow, but also Leytonstone to the south west there, which all sit around the periphery of the site. But there's a real opportunity around the Whips Cross development to create, as I said, retail, culture and other community uses, which really not only benefit the uses within the site itself, but also the wider context. And what's really critical is that we create links through to this surrounding context. The site's quite impermeable at the moment, and I'll touch on some of those new access points in a moment. Next slide. So just a bit about the local context and the character and identity of the site. The site has been home to a hospital for many years. The original hospital was built in 1903 as a workhouse, and latterly became a hospital around 1920. So it's been on the site for a long period of time, and originally it really had a connection with its surrounding landscape. So you can see a few of the images on the right there are archive images that we've sourced, and shows the relationship between the hospital and its surrounding context. There's a lot of water on the site, as you can see from the imagery, which we're dealing with as a kind of critical constraint at the moment. But it really does add to that connection between the healing environments within the hospital and the surrounding context, and that idea of of nature really helping kind of, the convalescing process. Unfortunately, it doesn't look like that today, as those of you that use the hospital will know well. The heritage buildings have very much been kind of encompassed by new development, which hasn't always been that sensitive to the heritage building. So what's important to us is to try and bring back that kind of critical character and identity of the site and build on the heritage within the site context itself. Next slide. So Paul's just going to talk around how we can bring that connection to the green space back.
Thanks, David. So yeah, this is a very early sketch, but as David just outlined there, one of the key features really of the original hospital was its position on the edge of Epping Forest, and the reasons for that, I guess, were to capture the well-being and healing benefits, the biophilic benefits of positioning a hospital against that landscape. And that's really important for us as we move forward for the new Whipps Cross. The sketch shows buildings in orange there as the new hospital site, and as Alice was describing in terms of the demolition of the nurses' accommodation, we're looking to site the new hospital on that part of the overall campus. And that really is an outcome from that strategic business case process, looking at various options for the location of the new hospital. And the reasons really for locating here are it enables a new hospital to be built as a single phase. And that's really important. So rather than spreading the hospital across two different sites within the campus, we can bring it together as one hospital building on a single site in a single phase. So that minimizes the disruption to the operation of the existing hospital, making the construction process safer in terms of the resilience of the existing hospital during that period. It also allows us to make best use and take best value out of the public money available for the new hospital. So we're spending that money on the new hospital, not spending that on decant processes as we move temporary accommodation around to facilitate construction sites. I guess the challenge that raises, and this is forefront in our mind when we became involved with the project, is potentially it moves the hospital away from the edge of Epping Forest, and it's very important to maintain that connection, to maintain the healing benefits that can offer. So the concept really in this sketch was sort of been an overarching concept for us, is to extend the influence of the forest, extend the forest into the site as a whole. And in so doing, really, we're creating the idea of a hospital in a garden, or a garden in a hospital. And I guess we could substitute the word forest there for garden, so it's a hospital in the forest. So we're bringing that forest landscape into the site and bringing that through to the front door of the hospital, bringing it into the hospital, and creating a range of green spaces within sort of roof terraces and pocket gardens within the hospital itself that enable a range of spaces both for patients and staff to take some contemplation and some quiet space, to provide opportunities for play for children, for some social space for, again, both for staff and patients, but also to make sure that from inpatient rooms we maintain a connection to that landscape and a connection to nature. And there's a lot of evidence, research and evidence over the last 20 years in hospital design about the importance of that connection, and providing accommodation with good views and views to nature has been shown to reduce the average length of stay for patients in hospital, but also has a real benefit for those people working in the hospital, and has been seen to increase the effectiveness of recruitment and retention of the best quality staff, and to having an uplifting working environment helps to reduce the length of time that staff might otherwise take as leave of absence through sickness. So we're creating these garden terraces and these little pocket gardens, and the pocket gardens work alongside these blocks are the inpatient accommodation at upper levels, working as pairs of wards around a central hub space, and that hub space is really a sort of social heart for the hospital. The new hospital will continue to be a district general hospital. Alongside that, it does the ambition is also for the hospital to be an exemplar for the care of the frail and the elderly. And that raises some questions. So the existing hospital is very linear, very horizontal in its form. It's low level and it spreads across a lot of the site. The implication for that is there's some long travel distances. There's a lot of walking distance that patients need to overcome in terms of their use of the hospital. And when we're looking at a frail and elderly demographic, we're looking to minimise that. So the idea of this sort of central hub means that the main departments are linked off that central space, and it reduces the amount of horizontal travel distance patients need to take. And it improves workflow and functionality between departments, improves those connections between the departments. But it's important that we maintain a social aspect to it, and that's what comes from there. We've shown this sort of heart on this sketch as well, and the idea here is to create a sense of place, a heart space within the development, and working with that value that the heritage buildings can offer us. We know that Whipps Cross Hospital has a place in the hearts and minds of the local community, and a lot of that is a connection with those heritage buildings. So what we're looking to do is strip away some of those add-ons that have happened over a long period of time, and create a better setting for those heritage buildings around a new public space, and David will talk a little bit more about that later, and locate the entrance to the hospital directly opposite that. So in terms of wayfinding, it's very easy for people to find the way into the hospital and maintain that sort of connection. And it brings the hospital into very much the heart of the site and continues that connection. So those are some of the key principles that we were looking to develop as we move through the next stages of the design. And as I said, we're at very early stages. This is a little bit further developed. And one of the other considerations we need to think about is it's the relationship of the new hospital building to its context. So these houses are on Peterborough Road, and this is Full Ready Road. So what we're looking to do is to reduce the impact of the scale of the hospital building on our neighbours. So the hospital then terraces back from Peterborough Road. This is south-west facing, so it means that these garden terraces get excellent sunlight and climate, so to make them usable spaces. And we pull the main bulk of the building, the height of the building, into the centre of the site, away from both Peterborough Road and from the Full Ready Road side of the boundary as well. This lower level building here is, Alistair talked about the need for a car park as a first phase of the works. And this is where we're proposing that car park could be. The reasons for that is locating the car park here, which would be built, let's say, as a first phase of the development to serve the existing hospital whilst we're building a new. So the entrance to the existing hospital is here, so there's a good connection from the car park to that. And then when the new hospital comes into operation, the car park is then connected directly with a bridge link into the new hospital. The space in between is where we're proposing the ambulance entrance will be for the emergency services department. So the car park helps to screen that from neighbouring residences. So in terms of those entrances, that's that gap I was talking on the previous slide, with the car park in the main hospital building and the ambulance drop-off is here. There'll be a drop-off for public for A&E entrance, separate to the main entrance. And this main entrance, as I was describing earlier, is opposite that public space. So it gives great clarity, and it avoids confusion between those two entrances. We separate those entrances so you don't enter the main entrance. If you're in a sort of state of anxiety, going to A&E in a hurry, this clarity of those separate entrances. And the fourth really is a drop off for maternity. So that will come through here directly to a lift position, which would link in directly to the maternity accommodation. So that allows ambulances and private drop off to that location at all times. We talked a little earlier about sense of place, and that's really important. So it's about building upon what the heritage buildings can offer in terms of the identity of Whipps Cross. But it's important that we create that brighter future for the new Whipps Cross. So we're talking about roads and spaces that are designed for people rather than designed for cars and vehicles. So they are pedestrian friendly, they're cycle friendly. We create attractive spaces that bring the greenness of the forest through into them, and really sort of locating that in that heart in the sky there is where the heart on the other drawing was. That central space which gives clarity through to where the main entrance of the hospital will be. So it's important that we, in designing a new, we're embracing what the existing site has to offer us in terms of heritage. I talked about sustainability in those principles, and we developed this idea of the sustainability charter, and that charter covers several different areas. It covers social, economic, natural, physical, and human aspects of sustainability. So some examples of that, in terms of human and physical, it's about getting good daylight penetration into the site and those views that I talked about to the hospital. It's about making patient journeys, sensory journeys, clear journeys that improves patient well-being. It's about promoting and developing the ecology and the biodiversity of the site and bringing that through from the forest, creating meaningful green spaces, both indoor and outdoor, using sustainable materials. And the energy side is obviously really important as well, but it's not all about energy. The energy side is very important. We'll make sure that the new hospital is energy efficient, and we include the opportunity to generate energy source on site where, as far as is practical for us to do that, given the demands of the hospital as a building. So I'm going to hand back to David, who'll take you through how that works, how the new hospital works in the context of that broader development. So once we've built the new hospital and the opportunity to regenerate the existing hospital site starts to materialise. So over to you, David.
Thanks, Paul. It's just worth noting before I continue, there is a chat function. For those of you that aren't au fait with WebEx, there's a little chat button to the right side of the screen. So please feel free to add any comments. We're keen to get as much out of these sessions as possible. So feel free to add comments there, and we'll try and answer as many as we can. So just touching on access, it's obviously critical to the development. I've talked about this becoming a new neighbourhood within this part of Hawthorne Forest, and what's critical is that we link this new development with its wider context. So the site at the moment is quite impermeable from the north side of the site there. So north is to the top left-hand side of the slide. So along kind of Fall Ready Road and Lee Bridge Road, and it's also quite impermeable along Peterborough Road. You can just see there to the bottom or the west side of the site. So what we're really keen to do is create new access points into the site. We've shown there a link along the route called the Panhandle from Lee Bridge Road. Lee Bridge Road is a key route through into the wider Leytonstone area. So we're really keen to create new pedestrian and cycle routes through into the site to really prioritise active travel. We're looking at integrating a framework, which we've shown there in the light yellow, across the site. So that people can use cycling and walking as real means of travelling, both within the site but within the wider context as well. There are some challenges around Whipps Cross Road access to the top of the page there, and we're really looking to widen that and create a more a wider access point into the site to benefit vehicles, pedestrians, and cycle movements. And next slide. So just a little bit around the master plan concepts that we've been developing. So these are very much underpinned by some of the slides that we've just taken you through around that connection to greenery around the site, and really embellishing the public realm within the site context as well. So these are all strategies at the moment that we've been developing around the park, the square, and the gardens. Just going through each one of these briefly. The park is very much about creating a new London square at the heart of the redevelopment. It sits adjacent to the main access to the hospital, but also provides visual amenity for those within the wards within the hospital, so they can actually view out over the park and further afield out towards the forest itself, connecting those healing environments with nature. The square is a space that's shared between the hospital and the wider new development neighbourhood. And again, a space that is at the heart of the development, allows people to sit, take a moment, have lunch, and would be the kind of the retail focus point within the development. And the gardens is a series of kind of distributed spaces that sit within the master plan, allowing kind of incidental meetings, moments, where you can read a book, or has different character within each of those spaces, including things like children's play and other hard and soft landscaping features. And it's not to say we're picking one or the other. This is very much around looking at how we can take kind of key elements from each of these and very much integrate that is the key point with the wider context as well. Next slide. So just a bit about the brief for the site. So as we've spoken about, the hospital is clearly at the heart of the redevelopment, a very important community asset. And we're really looking to add a variety of new homes within the development site. So not only flatted developments, but also townhouses and homes which offer real variety, with 50% affordable housing, and other opportunities to integrate multi-generational living as well. So looking at later living, potentially to the eastern boundary within the forest redevelopment kind of component of the site. So again, a different residential offering, and then variety in terms of the amenities on site. So restaurant, bar, cafe. Epping Forest benefits from a huge number of visitors per year, but has very little by way of amenity. So there's a real opportunity to drive some footfall into the site to benefit both the hospital in terms of staff and visitors and patients having access to other amenities around the site, but also for the new residents and existing residents. Next slide. And then in terms of each of these options, just going through them as a bit of an overview. So again, we spoke about the park, a real centralised location. And again, this sits around the existing heritage buildings, which I think, as I touched on at the start of the presentation, have very much been added to in a slightly insensitive way over the years. They've really been concealed, and opening those up offers an opportunity to create a quite significant new London park within this part of the borough. Again, creating those green connections, but also adding the opportunity for different activities, whether that be events, whether that be kind of mass gatherings, and other active objectives. I think the key thing here is that the hospital really acts as a linchpin to create active uses across the campus. Next slide. The square is looking about this centralised space that's shared between the hospital and the residential uses. Again, we are looking to develop new homes on this site. There's been a lot of good work that's been done by Waltham Forest in terms of their site allocations policy and the skyline study, which really starts to look at how the development will be viewed from various key views from around the site. They include the likes of hollow ponds, so some of the more open areas around Epping Forest, to some of the residential streets which sit around the site as well. So we're working closely through the planning process with Waltham Forest to really look at those views and where we position height on the site. So you can just see there at the image on the right, we're locating taller buildings to the centre of the site where we can manage those views more appropriately. But again, within the square, it's looking some of the precedent images that we've added there. It's about places where you can sit, you can have lunch, the place for staff to get out of the hospital and take a moment. Also to integrate public art as well is important. So there's visual amenity as well for patients within the hospital. And then the final emerging concept is that of the garden. So these are, as I said earlier, distributed spaces that sit within the master plan, again, potentially allow urban allotments, places for growing, connection with, with those community assets that we integrate into the site as well. And again, places for people to sit and take a moment. And this is very much about creating different spaces around the site as well. Next slide. I think it's back over to Alistair.
David,
Thank you,
before
David.
I hand over,
Thank
I
you,
wonder whether
Paul.
just
You're moving on, moving it on, Paul, yeah? Thank you. That's good. Thank you. Thanks to the two of you. I think for those of us that have been working on this Whips Cross programme for some time, it's just really exciting to start to see how these more detailed plans and concepts are really beginning to emerge now and emerge for real. I think we've done quite a lot of conceptual and visionary stuff over the last couple of years or so, but they're beginning to materialise into some really exciting plans. I do hope those of you that have joined us this afternoon can share some of our excitement, albeit that I recognise that there's a number of challenges that we're signalling here and a number of issues. I'm sure I've seen some of the chat that's going on, so we'll have a good kind of 20 minutes or so where we can talk in some detail a little bit and respond and listen to your ideas. Just a couple of things for me. One is just this indicative planning timeline that gets us to outline planning permission in the summer. So we'll continue to develop our thoughts in more detail over the coming weeks, and we'll move into a second phase of the planning consultation around the turn of the calendar year, ahead of our current aim of submitting the 2 planning applications to Waltham Forest before the end of February 2021. Of course, Waltham Forest, as the statutory planning authority, will then lead the consultation on those planning applications through the spring. And finally, the next slide looks ahead a little bit further when it comes up, and this basically shows our ambition, our aims, and indeed really our plans to get to a new hospital opening in around 6 years' time, on the assumption that we will get our business cases reviewed and approved by relevant government departments over the next 2 years. Our expectation is that we begin work on the actual construction of the new hospital in around 2 years' time. Our current expectation is that's a 4-year construction period, but we will work with our construction partner to see whether any of that can be accelerated. But that remains our current planning assumption in terms of the next 6 years to that point when we will be opening the new hospital in around 6 years' time. So thank you for listening to that. I think I'm handing back to Sue.
You are indeed. Thank you very much, Alistair. Thank you, Paul. Thank you, David, for that. That was fantastic.